Imagine you have a female patient. Katie Smith is 50 years old and she's on a waiting list for a coronary artery bypass graft surgery in 4 weeks. She has the sensation of pressure and tightness in her chest at times of increased activity and sometimes shortness of breath and fatigue while physical exertion. She has never had surgery before, so she's pretty nervous. Katie lives with her husband in one-story apartment and has two children who are in college right now. She decided to participate to the 4 weeks prehabilitation program because after surgery she would like to return to work soon. Katie follows a healthy food regime in order to not gain weight and she quitted smoking 10 years ago. Even if she has never done proper physical training due to her pathology, the patient is fit and willing to follow the training program. First of all, which goal should we try to reach before the surgery? It's important to understand that the prehabilitation program will not cure the pathology or the condition of the patient, but it will prepare the body for the recovery after surgery, improving the general fitness. As a goal, the patient would like to arrive at the operation feeling less out of breath and more strength in the muscles. Before starting the treatment session, few tests need to be assessed and the baseline parameters have to be taken. Blood pressure is gonna be measured and the exercise tolerance test, ETT, will assess how the heart responds while the patient is training. Moreover, heart rate will be constantly measured during each session. The 6 minutes walk test is used during the assessment to check the physical fitness of the patient. While the patient is performing the test, the physiotherapist will use the Borg scale to assess the perceived exertion. The intensity of the training starts from at least 50% of her maximal oxygen consumption based on the stress test, and it will be built up based on how the patient is dealing with the specific exercise. Before the first session and at the end of the last training, Katie has to fill the questionnaire SF36 about quality of life. Moreover, it will be measured even during the recovery after surgery. During the first weeks pre-surgery, the patient can attend classes of education about medication, diet, surgical procedure, and risk factors post-operative. The training will be 3 times a week and each session will last maximally 6 minutes. It will be divided in 3 parts. The first part is called Warmup and the patient has to perform a gentle stretching of the upper and lower muscles because we want to prepare the entire body. It will endure for 5 to 10 minutes. The second part of the session includes different types of exercises. Breathing training. It's important to improve the respiratory muscles and decrease the rate of post-operative complications correlated with the respiratory system such as atelectasis or pneumonia. The training consists of mainly 2 exercises with 2 different devices. The patient needs to sit on a comfortable and well-supported chair with the back straight and attached to it for both the exercises. The first device is called Inspiratory Threshold Loading Device and it will be used during the training session in order to train the respiratory muscles. The patient has to inspire against a threshold load whereas expiration is performed against no resistance. The inspiratory load is calibrated in centimeter H2O and can be increased as required. The subject starts to breathe at a resistance equal to 30% of their maximal inspiratory pressure, PI max. The resistance increases based on the rate of perceived exertion, RPE, scored on the Borg scale. If the RPE is P5, the resistance of the inspiratory threshold trainer increases incrementally by 2 cm H2O. The other tool is called Respiratory Exerciser, and it's significant to encourage sustained maximal inspiration, which is vital important for the general well-being of the patient. As you can see, the device consists of 3 columns, and in each of them there is a ball with different weights. The patient has to take a deep breath inside the tube, sustain, and then exhale outside of the tube. At the end, the patient should be able to lift all 3 balls. The training can last 5 to 10 minutes, considering that it can cause dizziness. Therefore, the patient has to be seated. The intensity cannot be increased. Three different aerobic exercises are included in the session to increase the cardio endurance and fitness. Cycling a stationary bike is safe and feasible. The seat has to be adjusted to the patient height, and you can use the graded trochanter as a reference point. Then the patient can start cycling with the hands on the handlebars. As you can see, the time can be manually set, and the patient should cycling for 15 minutes at least. Furthermore, the intensity can be increased based on the effort of the patient. The heart rate should be constantly measured through the stationary bike or an external tool. There are several types of training which can be used in order to overload the intervention. During the exercise, the Borg scale can be useful for the physical therapist in order to achieve more improvements, increasing the intensity. Another exercise is walking on a treadmill for 15 minutes each session. The patient can use the armrests of the machine to have more balance or just simply fit safer. As the stationary bike, even the treadmill has a display in which the physiotherapist can set the time, the intensity, the speed, and choose different type of training. The intensity will increase based on the perceived exertion of the patient, scored on the Borg scale. Moreover, light resistance exercises with elastic band or weights can be added to the training program if the patient is fit and safe. This training program can be even performed at home. The patient can learn how to use the breathing tools with the supervision of a physiotherapist and then use them independently. Moreover, Katie can walk outside for at least 30 minutes with a relative or a friend, so the training can become even more enjoyable. Thanks for watching, and I hope I provide you with a clear and structured training program for cardiorespiratory patients awaiting surgery. And if you're interested, articles and my research are available in the website ESPrehab. Bye!